You're welcome back to Morning Express. Let's roll the carpet in preparation for the second leg of our conversation here in the studio. Now, it borders around health, malaria in particular, and malaria in children, ways of preventing it, as an illness considered so small but yet so deadly. In the studio here this morning, we have Deborah Azeez, who is the Assistant Chief Head Promotion Officer at the FCT Public Health Department. A very good morning to you, ma'am. Thank you so much for finding the time to come here on the program.
Thank you so much for having me.
Well, first things first, I believe the right question to ask, which many people want to know, is what exactly is malaria? We have heard it before. We have experienced it. We have treated it. But in reality, what is malaria?
Okay. Malaria is a life-threatening illness that affects both children, adults, irrespective of your age.
Yes.
And it can make you to fall sick and being hospitalized. That is how fatal malaria is if not treated on time. It is caused by a parasite called falciparum. So if not treated on time, it can affect you in so many ways.
Well, why malaria prevention in children particularly? What demographic are more susceptible to contracting malaria and maybe even going to a fatal stage? Is it the older demographic or the younger demographic, talking about children now?
Okay. Why we are focusing more on children, or why we will say that it affects children more, is because of their immunity. Especially children under 5 are susceptible to malaria simply because their immunity is not yet strong enough to be able to fight the parasites, and they can quickly come down with it. Unlike we adults, if you consider what they eat, if you consider the lifestyle of these children and how they are being exposed, you cannot really compare it to how we elderly ones, the older version, the older generation are. So that is why it is very, very necessary to focus more on this younger generation so that they will not come down with malaria.
Now, this particular illness has been with us for so many years.
Yes.
Yet we continue to confuse it with fever from cold. They say you can't fight an enemy you don't understand. You have laid out the point as to what malaria is. But are there certain symptoms or signs to look out for exactly to distinguish between a malaria fever and a fever from a common cold?
Common cold,
or even any other type of fever? What exactly distinguishes malaria from every other illness?
Okay. Fever is one of the symptoms you look out for when you have malaria. So because you might, there will be tendency of you having runny nose, headache, cold, high temperature. Coupled all together, that is what you look at for as signs and symptoms that you say, oh, this person is having malaria. Unlike normal fever, you can be shivering, you can be having any other symptoms. Yes, but majorly, for somebody to say that I have malaria, it has to be, you have to go to lab, they have to test you. There is RDT now, rapid diagnostic test that you can easily do for you to ascertain that indeed I have malaria, not just by you feeling your temperature or you just use thermometer and say, but any fever above 37 degrees centigrade, and coupled with the run a test, whether RDT or lab confirmed test, so you can term it to be malaria, whereas they will pick out that particular parasites to show that indeed this person is having malaria.
When you were making your introduction as to what malaria is, you described it as a deadly illness, a life-threatening illness.
Yes.
We have known malaria for a lot of years, or a number of years, and each time anybody gets sick, they say, oh, it's malaria and typhoid, you know, which, by the way, I know is the wrong way to go about it, but people always associate malaria and typhoid, and then they go to a pharmacy and get over-the-counter medication, self-diagnose themselves, self-prescribe medication to themselves, and take this medication, and somehow, over time, they get fine or they get well. But how is it life-threatening, and why do some people end up not surviving malaria?
Okay, so why it is life-threatening is because of this misconception that people have in treating it.
Yes.
Once you are runny nose, or once you are having some signs and symptoms that can be related to it, you can say, oh, I have malaria. You just go over the counter and just buy some medication and treat yourself. But why it is life-threatening is because there might be underlying issues. There might be underlying ailment coupled with that malaria that you are having. Yes. And you just suppress it with that anti-malaria drug that just take over the counter, and you might not really treat it effectively. You know, some people in some pharmaceutical shop or just nearby chemist, they will just do some concoction for you. You will not really treat it as it is supposed to be treated.
The proper dosage, the proper medication, and all of that.
And the number of days that you're supposed to take it. So doing all of this, and it's just suppress it, after a few months or weeks, you still come back to it again. You are taking all this medication over and over. You might consider yourself damaging some vital organs within your body system. So why don't you just go to the hospital and get tested, get treated appropriately and effectively?
And some people might even after going to the hospital, getting proper diagnoses and you know, a prescription done for them, once they start taking the medication and they start getting better, or they feel fine, they stop the medication. What adverse effects does that have? I believe this has been emphasized time and time again. Finish your dosage, your prescription, take the full dose. But when you don't take the full dose, what does it do? There
will be resistance. So once you are supposed to take a particular drug for so period of time prescribed by a medical doctor or physicians, and you don't take it as prescribed, there will be resistance. By the time you come back, you have similar experience and it is being prescribed to you, it might not work effectively. So that is why it is being admonished, or they will encourage, finish your prescription as prescribed. And when you have similar symptoms, don't go back and say, oh, this is this type of symptoms that I've been having, and this is what was prescribed for me.
Go back and take the same medication.
No, it might not work. It might not be the same ailment that you are having. There might be some like correlation, or like I'm feeling the same symptom, but it might not be the same illness. So it is good that you go for proper diagnosis and commence treatment.
Let's talk about prevention methods of malaria. We have seen individuals who say, oh, once your genotype is AA, anytime it's the rainy season, you will have malaria. Or if you live around riverine areas, or areas with murky or dirty water, or drainages, due to the infestation of mosquitoes and all of that, you would have malaria. What exactly is a clear-cut, perfect way of preventing malaria? We have seen mosquito nets and the rest, but are there other ways that you think measures can be taken, both by individuals who live in, you know, dirty environments and people who live in clean environments, to ensure that malaria is pushed back to the latter?
Okay, good. That is part of why we are here today. One of the preventive measures, among all others that you mentioned, like sleeping inside treated mosquito nets, you know, keeping your environment clean, is this seasonal malaria chemo prevention.
Take that again, slowly.
Seasonal malaria chemo prevention.
What does that mean?
Okay. It is safe, free, and good measure of preventing malaria in children from 3 months to 59 months.
Okay.
So it is combination of 2 anti-malaria drugs, sulfadoxine, promethazine, and amiodarone. It is called SPAC.
Yes.
It is combination of these anti-malaria drugs given to children from 3 months to 59 months. That is from 3 months to 5 years.
Yes.
What it does is that during rainy season, there is this high prevalence of mosquito breed, which, like we mentioned during our first conversation, that children, there is tendency of children coming down more with malaria during this season. That is why it is being introduced by governments, by WHO. It is certified by WHO, coupled with National Malaria Elimination Program and FCT too. They joined together. They are joined together to introduce these drugs to our children, so that once they take it, it is not a medicine to treat malaria.
Yeah.
It is a preventive measure,
almost like a vaccine.
Good,
Okay.
but not a vaccine.
But not a vaccine. Just a combination of medications and drugs called SPAC.
SPAC.
In total.
Yeah.
Okay.
Given to children for the period of 3 days, though it is being done for 4 days. And
children from how many months old to how many years?
From 3 months.
3 months.
Once a child is 3 months to 59 months.
59
this
months.
drug is being introduced to them to prevent them from coming down with malaria.
Is this an information that is available readily at healthcare centers across the country?
Yes.
Okay.
Yes, it is available, and you will see, and those people that are giving these drugs are trained community direct distributors. They are not just anyhow person. You see them in their uniform, some with face cap, some with t-shirt, some with apron, and they are called community direct distributor. It is direct observed therapy.
Now the reason why I'm asking these questions is due to the fact that they might be, pregnant or expecting mothers, first time, parents who might not really have proper information as regards to some of these preventive ways of ensuring that their children are protected from malaria. Okay. And why I also asked if it's readily available at healthcare centers is because what is obtainable at a general hospital is different from what is obtainable at a federal medical center, and also different from what is obtainable at a clinic or just a primary healthcare center in a village somewhere. Okay. Is there a balance of information across all health facilities across the nation? Yes,
there is. Okay. So there is no health facility that you will go to that they don't have prior information as regards this pack that we're talking about. Yes. But I just want to emphasize on this, that this SPAC is being given house to house. We are using house to house strategy.
Okay. Which is more effective?
Which is more effective. But that doesn't mean
like the polio vaccination campaign.
Yes, but not necessarily that when you have a nearby health facility and you go there during the time of the campaign that you will not be able to have access to these drugs. But during the time of this campaign, it is usually 4 days in a month, and we just finished that of this month. So, and the next one is commencing on the 4th day, about 4th of September to 8th. So it is being given door to door by trained CDDs, community direct distributors, and they used to give it to caregivers, parents, which they will administer the first dose while you are there with you. They will ask you to bring your water, they will miss it there, they will give it to the child, and emphasize on you giving the second and the third dose to your child subsequently.
3 days.
3 days at a stretch. So once this is being done, it will prevent our children from the age bracket of 3 months to 59 months from coming down with malaria, coupled with other strategies in place, like sleeping on insecticide treated nets, keeping our environment clean, and all of that.
You didn't comment on the perception, or should I say narrative, that individuals who are AA in terms of genotype are more prone to contracting malaria during rainy seasons. Is this a myth or is it true? Let's clear the air now.
Let's clear the air. Okay, I would not really say yes and no.
Okay.
Simply because your lifestyle too can make you to be prone to heat. Whether you are AA, you are AS, you are SC.
Madam Deborah, you are being diplomatic. Is it a myth or is it true?
I cannot really. Is it scientifically backed?
I don't know.
That is why I said, if you are AA, you are not sleeping under insecticide treated net, or you are AS.
Yes.
Your environment is dirty. You have stagnant water all around you where mosquito is breeding, and they are perching on you. And you are saying, because I'm AS, I'm not AA, so I cannot really come down with malaria. That's like a fallacy. You understand? So whether you are AA, you are AS, you are SC or SS,
yes,
there is tendency of you coming down with malaria once you don't put all these preventive measures in place. So that is
well, let's talk about how badly malaria affects children in the country, as well as pregnant women. I had mentioned expectant mothers and first time parents and all, but we have seen a high prevalence and mortality, especially in children and also pregnant women. What is the statistics looking like? Is it looking good, and also what measures are being taken to tackle this high prevalence of malaria in these two demographics, women, pregnant women and children? Okay.
Once a woman is pregnant, it is being advised that you start your antenatal clinic. And during this period of antenatal clinic, they used to give them anti-malaria drugs. Simply because you are no more yourself, you are carrying a human being inside of you, and your immunity might not be strong enough to carry you through this pregnancy period of time till you are term and you want to deliver the baby. That is why once you start your antenatal clinic, they will give you anti-malaria drugs like up to 3 times before delivery, simply because there is high prevalence, that you mentioned earlier, of mortality and morbidity of pregnant women, coming down with malaria, and before you know it, the fatality rate is high and you just see them dying. That is why they will introduce anti-malaria drug. But it's not the same thing as this pack that we're talking about. This pack is just for children. The one that pregnant women used to take is being given to them in the hospital during antenatal clinic.
Okay.
And that of the children, like I've mentioned earlier, is because their immunity is not yet strong enough. Like I've mentioned,
you had laid out
that is, and the rate at which our children are dying due to this preventable disease, which is malaria, is very high. If you look at the statistics online, you will see that it is not really friendly, and it is preventable. So why are our children dying? Why are the pregnant women dying from preventable diseases with something that is not really serious in treating or being in preventing?
Now, I just think that our viewers might want to get better insight into what Madam Deborah here had mentioned, that the seasonal malaria chemo prevention, SMC. Now I believe this is where the SPAC falls under. Now, is SMC also obtainable to adults?
No,
just children.
When
we're talking about prevention of malaria in children, there are some key implementation strategies that you might want to know. It says here that SMC is implemented across all 6 area councils, covering 62 wards and 274 health facilities, led by the National Malaria Elimination Program, and is being implemented by the FCT MEP with support from Malaria Consortium. Now, in 2025, that's this year, personnel engaged 30 FCT Area Council, 274 officers in charge of health facilities, 834 CDD supervisors, 7,313 CDDs, 248 community leaders, and 843 town announcers. This seems to be a very, very huge campaign.
Yeah.
It's massive.
Yes.
We're talking about thousands of individuals involved within the FCT alone.
Yes.
Is this campaign just for the FCT, or is this going to be extended beyond the FCT? I know you are here representing the FCT, but I just want you to speak on a generic level.
It's not only in FCT. Yes. This is a campaign that is being done in other states like Kebbi. I know Ogun is running. We have so many other states that are doing this SMC campaign too. Yes. In collaboration with Malaria Consortium, and it is being spearheaded by National Malaria Elimination Program Office, which is Federal Ministry of Health. So it is not only in FCT, because we are not just considering children in FCT alone. We have neighboring states that even border with FCT. So if you are just saying, oh, we are focusing more on FCT alone, what of neighboring states that there can be influx of people, and even influx of mosquito. Look at our neighbor here, Malaria. It's very close to Nasarawa State now, and people are coming down from there too. So they are doing it in other states, not necessarily FCT.
Not necessarily FCT. In 2025, Circle 1, I believe that's what you call it.
Yes.
Circle 1 commenced in June.
Yeah.
With a Circle 1 administrative coverage of 98.4%. That's a staggering 967,777 children.
Yes.
Almost a million children.
Yes.
Just within the Circle 1. How many circles are there?
Though we have, it is being run like 5 circles in a year.
Yes.
Like we start June, we've done that of July, and this is the 3rd circle of August. So we'll be doing the 4th in September, and it will be rounding it up in
So you are targeting
October.
A total of about 5 million children before the year ends up?
Even more than.
More than 5
More
million.
than 5
but
million.
in June, you had just a little below 1 million
1
children.
million children. And that is why we are advocating now. We want caregivers to be aware. That is where we are creating awareness that Spark is safe, reliable, and it is free. It is not something that you go to nearby chemist to get over the counter. It is very safe, effective, and free for your children. So why don't you avail the children of this opportunity of getting this pack that we're talking about? So we are targeting our children above 5 million self. Just bring them out in masses for us. These drugs are readily available to be given to them.
Just state the role of CDDs in the SMC campaign and also the Spark administration that you have mentioned, because there were a lot of technical terms that I had read out, but they were not quite clear, and I believe a lot of people also want to know the role of these CDDs in the campaign.
Okay, CDD in full meaning is community direct distributors. They are trained healthcare workers.
Yes.
That are they've undergo training, and they will be going door to door to administer this pack to children from 3 months to 59 months. Once they knock at your door, they will show their means of identification, whether by face cap, by the cloth they are wearing, and you will even see the bag where like all these small children is being drawn on the bag. These are the
images of kids.
Yes. These are the means by which you can easily say, oh, these people are coming from government. It is government approved people. So once they come, you will see that they will introduce themselves. Then they will give you this drug, which you will administer to your child that falls within this on the spot, that falls within this range.
3 months to
59 months. So they will be there. They will teach you how to administer this drug the first day. While they are there, you give it to your child. Then they will now tell you how to give the 2nd and the 3rd dose to your child at home. So they are well-trained healthcare personnel.
Now, which agency is responsible for implementing this SMC in the FCT?
In FCT Public Health Department, in partnership with Malaria Consortium.
Okay, that's give us some better insight into the activities that you guys are doing. I believe you're from the FCT Health.
Exactly. Yeah. So, like we are creating awareness, so that people will be better informed. So that we'll be able to correct these myths and misconception, like you mentioned about AAAS or whatever.
Yes.
So to give better understanding about this malaria and other illnesses, FCT Public Health Department, mostly Health Promotion Division, these are part of what we are doing. We are creating awareness. We are doing social mobilizations. We are engaging community leaders. We don't do this thing alone, because we know our people within the community, there is tendency of them believing more in their opinion leaders. We call them opinion leaders. So we engage them. We do community dialogue.
Yes.
So we engage them, we talk heart to heart, we do focus group discussion, where all these myths and misconceptions are being addressed.
Yeah.
Then we give them reliable information, and which can be cascade to their people. We engage religious leaders too, because we believe, these
traditional leaders
too. Our religious leaders, we believe more on them too, because we believe they spoke man from God to us.
So beyond the television interviews, beyond the radio interviews, beyond advertorials on newspapers and magazines, you are also engaging in community and engagement.
Yeah.
Community leaders, religious leaders. How has the reception been like for you since you started the program?
Perfect.
Perfect. No glitches, no hitches.
No hitches. Once you carry them on from the beginning, you have a 100% success story in any activities that you are implementing.
98-point-something% is quite a very huge target to hit.
Yes.
And you have been able to do that in the month of June. I don't have the figures for July. I don't have the figures for August, but June was quite commendable.
And even in July too, we have over that percentage. Yes, about 97 point something. I cannot really lay my hand on it.
Okay.
But we have a good turnout too.
Yes.
And engaging all these our leaders has been very, very helpful for us. And even these community direct distributors that we are using, the town announcers too, most of the healthcare workers are being recruited from the community. They are faces that you have seen before.
Yes.
So you believe your people cannot really do you bad.
That's true.
So once they are trained and they are inculcated into these activities, we are having good flow of communication, good flow of giving these children this spark in the community. So it has been very good, will I say, a massive turnout of people receiving this.
Nevertheless, okay, carry on.
Nevertheless, we cannot really say that we don't have itches. We cannot release, because we have so many people that are, let me put it this way, educated illiterates, that know that I too know.
They're a little bit suspicious of what you are coming to give their children. Much like the situation we had during the early days of polio vaccination and all, people chasing away these healthcare workers who are there to help them and help their children as well. So you have had such situations.
We are having
How
such
was that
situations
handled by your team?
And though we call them non-compliance cases.
Yeah.
So we used to engage them at times one-on-one discussion, and that is why we said we are engaging with all these our opinion leaders that we can through them be able to influence them to talk to their mind. And at times we ask them to go online, let them research more on their own, so that they will be able to get more facts about what we are giving. It is NAFDAC approved, it is WHO approved too, and so that is why we are buying into it.
Now, in giving more facts about this SMC and SPAC, but SPAC aside, let's talk about SMC itself. You called it seasonal malaria chemo prevention,
Yeah.
and it is mainly for children.
Yes.
Can you lay out the benefits one step at a time in a more streamlined, understandable, layman way for people watching us to understand the need to not chase your healthcare workers with cutlass when they come to their doorsteps?
Okay, I will take it one by one, like you mentioned.
Okay.
Like for the children.
Yes.
it will make them to be safe and sound. Once a child is coming down with malaria,
yes,
it affects their cognitive way of reasoning. They may not be able to assimilate well in class, and there will be miss out during class section,
yes,
which can make them to repeat that class at the end of the day for something that is preventable, quote and unquote. So for children, they can fall sick, they might not be able to attend class regularly, they might not be able to concentrate well in class once they are coming down with malaria. That is for the children.
yes.
For the adults, remember you are the caregiver. Peradventure, I have on the 5 children now that are at home and they come down with malaria. Will I be able to be here?
Certainly not.
Not. I'll be in the hospital. That is affecting me personally, affecting my job,
Yes.
affecting my source of income, because this is where I earn my daily 1 or 2 kobo.
Yeah.
So when I'm not readily available there, maybe are people that are going to market to sell their products, you are not there, you are at home treating these children. So it is affecting your daily income, family income as a whole, and at the same time, you know, the stress that I'm putting myself to in treating these children, in taking them to the hospital, the time that I would spend with these children, at times it might not be something that you can now treat at home. Such a child might be hospitalized. So going from home to the hospital, you know, time constraints and whatever. So it will affect you. That is too. Economically, it's affecting us too.
Yes.
Because you are not being productive. You are not productive. You are not adding to our economy.
You're not carrying out your best activities out during the day.
During the day. Yeah. So it's affecting you in that area too. So you might not be able to do so many things for something that is preventable.
Now more information on the WHO policy recommendation for SMC in 2012, which was based on the results of 7 studies conducted in areas of highly seasonal malaria transmission in the Sahel regions of sub-Saharan Africa between 2002 and 2011. I wish we had those infographics, but hopefully during the course of the program, we hope to get that across to you, our viewer. Evidence from these studies showed that SMC with SPAC administered at 28-day intervals to all children under 6 years of age during each malaria transmission season. 1. Prevented approximately 75% of all malaria episodes. 2. Prevented approximately 75% of severe malaria episodes. May decrease child mortality from 3 per 1,000 per year to 2 per 1,000 per year. That's a very good figure. May reduce by 1/3 the incidence of moderately severe anemia. Now, in 2020, results of an observational study to evaluate the effectiveness of SMC in West and Central Africa demonstrated that SMC at scale was effective in preventing morbidity and mortality from malaria. SMC was associated with a protective effectiveness of 88.2% over 28 days in case control studies. It shows that SMC has had quite a very good track record, even from the early 2000s. So why are people still rejecting it?
So we cannot but have non-compliance case.
Yeah.
Like I've mentioned earlier, that we have some that are educated illiterate and some that are even not educated. You know, our people tend to believe that whatever comes freely is not really substantive or whatever. Yeah. But that is not true. That is in the time past. That is why this awareness campaign is coming up, so that they will be well informed.
Yes.
What you don't know, you don't know.
That's correct.
So what you know will be able to give you the opportunity to be able to accept it. You know, when you are well informed about a situation,
yes,
you can be able to beat your chest. Because all this SPAC that we're talking about, this SMC program, it is well proven Like you've read it out from WHO and from facts and figure.
Even from early 2000s, 2002, 2011, even now we're in 2025. That's over 20 years of consistent track record, good track record.
I'm telling you. And people still tend to say, no, I'm not taking. But that is why we are still encouraging them. We are giving out this information.
But Madam Deborah, let's address some myths and misconceptions on SMC now that we have laid out the success story of the program over the last 2 decades and some years. Now, some say the medicine is too small or too strong for small children. Okay. Babies of a couple of months old taking such medication. I personally am not a medical scientist, so I don't know the strength of the medication. I've never taken it. I don't know if I did. I certainly did not. Of course, I certainly did not. Now, others say if the child is not sick, why give them medicine?
Okay, like we've said earlier, it is preventable medicine. It is to prevent them from coming down with malaria. Though once a child is being given, quote and unquote, for children that are not sick, it is not a treatment
for sick
therapy
children.
For sick children.
It's a vaccine-like medication mixture.
Yes, for children, not for treatment, not like any other anti-malaria drugs that are being given to children. So once you give it to your child, there might be tendency, immunity divers, like I've mentioned earlier. A child might have maybe temperature, very rare cases, temperature, maybe headache or runny nose. So a child should be taken to nearby health facility for proper assessments. But that is maybe 1 in 10 children or 2 in 10 children. So it's not likely that once our children take this medicine that they will come down with malaria itself. It might trigger it once maybe a child is having malaria before, but it has not yet shown. You might, even as an adult, there might be that you've been bitten by a mosquito. There's tendency of you coming down with malaria. You don't treat it on time. So also our children, if they are not sick before, but they are being given this spark, and they now come down with some signs and symptoms, the best thing to do as a caregiver is to take them to nearby health facility where they will be properly diagnosed. They will be properly diagnosed and treated. Yes.
But you haven't answered the question as to whether or not it is too strong for small children.
It is not too strong. It is not too strong because it is tested in the lab. It is NAFDAC approved. They will have looked at the dosage that is appropriate for children. And the one given to children from 3 months to 11 months differs from the one given to children from 12 months. That is from 1 year to 5 years. So the dosage...
So even the dosage differs. Yes. The type of medication itself also differs.
Yes. The combination of the medication for the children between 3 to 11 months differs from those ones from 12 months to 59 months.
59 months.
Yes.
Are there any side effects that people should look out for? Medication or drugs work differently in different people. Somebody might take something as little as Panadol or paracetamol and there might be some side effects immediately. Others take stronger medication and they don't, have any side effects or feel anything. Is there maybe a lab certified side effects that parents should maybe look out for and not get frightened when the side effects start occurring?
Some children might be having maybe body temperature after you commence this drug. You don't need to panic. You can just give paracetamol at home. But the best thing, if you feel that you are not comfortable, please take that child to a nearby health facility. Mostly it is just maybe running of temperature. Some children might complain of headache, and that is 2 in 10 children or 1 in 10 children. It is not something that is rampant like that. Some children, you will not see any side effects. So that is why I said immunity differs. What might affect me might not affect you.
That's correct. So that's now, while we prepare to wrap up on the conversation, let's talk about community engagement and participation. I know you had relayed a point earlier that you go to traditional leaders, you go to religious leaders, because people tend to listen to them more often. But what is the role of these community leaders and healthcare providers on implementation of the SMC campaign?
Okay, the role of the community leaders majorly is to help us in recruiting all these our CDDs,
Yes.
the people, the town announcers,
Yes.
within their community. We want them to be like our interface, people that will be relating with directly, people that they know within that community. That is their role, and for them to be able to give accurate and good information to our people within their community too. So we engage them, we give them facts and reliable information, so that we will not be saying A and they will be saying B, C, or D. So we are using one voice, one trusted voice all together within our campaign. That is why we mostly engage with them. And lest I forget, we are starting like church strategy, because over the time we've been doing house to house, door to door campaign, and we've been having missed children. Like we don't have 100% coverage. Like you mentioned earlier, 97 point something, 96,
96
point something percent. So we are like, there are so many of our children that are in church that we really want to target. So this fourth cycle will be moving into our churches. So let our listener know that they will be seeing these community direct distributors within their churches. So they should accept them. They should bring out their children. This will commence on the 7th of September. Just Sunday alone.
For the administration of the SPAC.
The SPAC. For our children within 3 months to 59 months.
59 months.
Yes, the fourth cycle will start on the 4th of September. But note that will be coming to churches on the 7th, which is on a Sunday.
How many churches are you targeting?
Many churches within
as many as possible.
As many as possible within FCT. On all our 6 area councils, we'll be going to churches to administer these drugs to children that are missed at home, that we don't have opportunity of meeting. Maybe they've gone out with their parents, or they've gone to school, or just like that. So we are targeting them within churches.
Now we have talked about traditional leaders. We have talked about religious leaders. Let's also talk about the media. The role that the media plays in this wonderful campaign that you are doing, as well as healthcare providers who might also want to lend in their hand to fight malaria to the full. So you people are doing wonderfully well. Let me commend you. Thank you.
You are doing wonderfully well.
I'll take the award on behalf of media personnel.
You are doing wonderfully well. And of recent, we have a media parley in which all media organizations come together. We discuss. They pour out their heart, and we give them facts and figures, like you've read out before, and what they need to know about this. I believe media personnel, you people research more, even though you are not in health. I believe you people research more, and you've been doing wonderfully well. We've been collaborating together. You people are giving our listeners correct and good information by what is being given to you by our so-called professionals in the field.
So the thanks still goes back to you. Thank you so much for giving us the information.
Thank you, sir.
But healthcare providers now, how do you recruit them to join the campaign? Is it based on individuals who already work in certain healthcare centers that you have pushed the campaign to, or can maybe people who are healthcare providers and are not gainfully employed at the moment just show up and choose to join the campaign to help with spreading this news of good news of SPAC?
So once you are eligible, once you are certified, and once you are being introduced, remember I said we work with the people within the locality. So that it is a familiar face that you are seeing. It is not like I'm living in maybe Kabusa and I'm
going to Maraba
to do it. You might say, oh, I'm not seeing you for the first time. So if you know you are certified and you are healthcare professional, move to the nearby health facility, introduce yourself with your license or whatever means of identification that you can. So
you might be considered for a recruitment.
Yes, for this period of time. It is it is transparent.
Yes.
It is not something that is politically that you will say, oh, it is for so number of people, it is for
or
this.
it's for this demographic, or you have to have this particular certification. I mean, being a healthcare professional,
you are certified already.
Yeah, you are certified, but it doesn't have to be a certain level or who knows who, that sort of connection.
No.
Okay. Well, in a moment, we know that SMC saves lives, Madam Deborah, but if it's such a powerful shield against malaria in children under 5, you had mentioned 3 months to 59 months. Why isn't every child getting it? And what are the real challenges stopping this life-changing medicine from reaching every home within the FCT?
I will say caregivers, parents. We are like a challenge to these children, because they cannot make informed decisions by themselves. It is when you avail your children of this opportunity that I'll be able to give this preventive medicine to them. So it boils down on we caregivers. We are the one not knowing that at the end of the day you will suffer most out of this if those children come down with malaria. So it boils down to caregivers, parents, and like we are like a challenge, a barrier, let me put it this way, to these children not being able to take this preventive medicine that we are talking about.
But projecting, say, from now to the next, I don't even want to say 5 years, but from now till the end of the year, when you partake in the next set of circles, how would you see, or how do you see the success rate looking like? Do you think that SMC and SPAC will be more welcomed by caregivers and parents within the FCT?
Yes, I believe. And that is part of why we are here. That is part of why we are creating awareness. We are engaging them. We are talking to their mind. Let them know that it is free, safe, and effective. It is being approved by WHO, by NAFDAC. It is not something that is just being sold over the counter. It is something that once you are not getting it from government, you are not getting it from anywhere. So that is part of why we are just speaking to their mind, that let them avail their children of this opportunity. It is preventable. Malaria is preventable, and your children can have access to this freely without you paying a dime to access these drugs that we're talking about.
Now there have been cases of diversion of this pack meant for children. How did you handle that, or how have you been handling such cases?
Okay, in FCT, I would say we've not heard of such. I cannot say in other states.
In other states.
But nevertheless...
But how do you prevent it?
Yes, because before you are giving SPAC, you will have do your daily implementation plan, DIP, which we know the number of eligible children within this axis. There will be a target population. Maybe we'll say within this Gusape axis, we have like maybe, let's say, 2,000 children that are eligible, that falls within the age range of 3 months to 59 months. So we will work with that target. We will not just give you excess drugs when we know that we are not having some those eligible children within those assets. So there is what is called daily implementation plan. You work with that daily implementation plan. Okay, in these streets we have like maybe 20 children. So it is that 20 that will be given to you for that. So there will not be fallout.
So there has been some sort of survey already done before the campaign began.
Started, yes. There are daily implementation plan that are in place. And with that, they will now give you that drugs. You go into those community, give it to them. If you don't meet them, it is being done for like 4 days. Remember, the drugs is given for 3 days. But why it is done for 4 days? Because of the missed children. Excuse me. You might get to a place that you don't have, that you don't meet them at home, so you can easily come back to give them those drugs.
Well, in summary, can you tell us the importance of this SMC and how our listeners, I believe they would want to know, can help promote it in their communities as we prepare to let you go from the studio? I believe you have you have done justice to this particular topic, but the floor is yours.
Okay. So our listeners, I really want to commend your efforts. You've been doing wonderfully well. Our caregivers, you've been giving us access to our children within FCT. But we just really want to say again that please give us more access to these children. SMC, seasonal malaria chemo prevention, is a preventable means of not making our children to come down with malaria during rainy season. Spark is safe, free, and effective. Please, let's work hand in hand to chase malaria out of FCT. Thank you so much.
I think you deserve a round of applause.
Thank you, sir.
Well, thank you so much, Deborah Azeez, Assistant Chief Head Promotion Officer, FCT Public Health Department, for finding the time to come around and share this information with us on malaria prevention in children.
Thank you for having me.
Thank you. It's
sir.
been a pleasure.
Yeah, I appreciate it.